My dear friends, I'm Dr. Neeraj Jain. I'm Senior Consultant Spine and Pain Specialist. I own spine and pain clinics, and I work as a Senior Consultant in Max Hospital, Shalimar Bagh and Balaji Hospital. Now, let's understand, why the pain management, what is the importance of the pain management or pain clinic for that matter. Pain is one of the most common symptom people present in the hospital, and it's the most ominous thing which patient come with. So we really have to look at the symptomatic part of it, because it's not the blood sugar or blood pressure, which affects the patient, and patient doesn't know about it, and they go for treatment and doctor only tells about blood sugar and blood pressure. It's something which patient comes and tells, patient has got a problem, patient's got a pain, and patient comes with the objective problem in that there's a problem, pain coming from. So you have to take patient's word into account and treat it accordingly. Now, any pain which is not been treated in 4 weeks time, that really needs some serious concern and serious treatment. So one should see a pain specialist. If you think any treatment which is not good enough for last 4 weeks, you should go and get more investigation and a targeted intervention done. Now, what pain specialists they do it? They under one roof they have all those diagnostic and therapeutic interventions which has been done. So first we have an eye to have a look at, like in cardiology, in medicine there's a cardiology, neurology, gastroenterology. Same way there's a pain management which entails all specialties put together. Any patient who has not been helped for last 4 weeks, it's the time they should see a pain specialist. Now what all we look at is, a patient's got a back pain now. It happens with almost 20% of population any given point of time. Now Delhi has got a population about 2 crore, let's take NCR. So about 40 lakh people has got a back pain, and of this 4 lakh people have a serious back pain which needs actual treatment, maybe a hospitalization if need be. Now what is to be done is, if you don't treat it in time, the bigger problem is this becomes serious, and then you obviously have to go for operative measures. Now what happens is, if you catch it early, you can manage just with the precautions, lifestyle changes, some diet variations, some exercise and some medicines and some physiotherapy. But if it's late, then we have only option is the surgery. We want to avoid spine surgery, because spine surgery has got a lot of hangover and overlays. The whole idea is, if you can catch it in time, precautions, conservative management, and then if it is not really getting help before surgery, there's a very good modality these days which is called intervention pain management, whereby with non-surgical treatment you can really manage all this back pain and slip disc, sciatica, cervical pain, cancer pain, or fracture spine even, all this, or neuropathic pain for that matter. All these domains can very well be done, including the cervical pain and headaches as well. So what we do is, we diagnose them, we do targeted management interventions, we go to the spot where there's pain coming from and block the pain from there. So that's the best thing which has happened in the latest in the medicine, So what we do is, like suppose there's a patient got a back pain and it's been there for years together, and suddenly the disc is with disease, and suddenly it bursts open one day and it becomes a leg pain which is called a sciatica pain. Now what we have to see is, you have to diagnose with the clinical aspect, then MRI. Once you have the exact diagnosis with you, you just have to take the patient under the C-arm and just go to the disc and treat the disc just with the needle. We can call it a needle surgery or needle discectomy. It's just like angiography. A patient has got a heart problem, there are 2 treatments which you have beyond conservative management, which is the angiography or the heart surgery. Same way in spine also, before any open surgery is to be done, there's something very good modalities, intervention spine management procedures, which are almost non-surgical, and minimum invasive spine surgeries are there, you can call it. And they work equally well as good as surgery, and without the complication of the surgery or without the surgery per se. The other idea is, if patient has got a osteoporosis, has got a pain, back pain, if it's not getting adequately treated, you can see a pain specialist, and if the MRI shows there is an imminent fracture or a fracture, we can simply put a needle, inject liquid cement inside. Now what we go is, we get inside in the body and inject liquid cement inside. Now this bone becomes the hardest bone of the body. Now, understanding is important. Osteoporosis and the osteoporotic fractures are commonest in the spine all over the body. We know about hip fractures, we know about shoulder fractures or wrist fractures, but people don't understand the severity of the spine fracture. Because if spine fracture is not taken care of in time, it can go and pressurize the cord, and there can be cord damage, and patient can be permanently paraplegic, and the paralysis you can call it. Both legs, they become dysfunct. So we should really treat it in time if it should not get serious. Because the treatment is so simple and so easy. The whole idea is, there are treatment available which are very effective, which are almost non-surgical. Why suffer? Why allow complication to happen and then go for an open surgery? let it be in time. So this is called a vertebroplasty, or even if it is collapsed, we can do a kyphon ballooning and we can do a kyphoplasty. So this is it. About cancer pain, one important thing is don't die before actual death, because cancer patients, they have pain almost every day and they are almost dying every day. So I don't like that part of it, because cancer is curable or not is a different story altogether. But cancer pain is definitely curable. We can treat cancer pain and patient can have a quality life in whatever days are left. We call it, if we can't add days to your life, we can add life to your days. At least the quality is better and patients back to the life till the last day of life. This is the beauty of the cancer pain. And about the slip disc, I mentioned you, but the other pains, which is arthritic pain and headaches, they can also be taken care and adequately helped without going for surgery. You don't have to go for like trigeminal neuralgia. Patient keep taking treatment for years together. You don't have to do that. Now what you have to do is, you just have to go to a pain specialist. He'll put a needle in the trigeminal ganglion, block the ganglion with the radiography machine, and your pain is taken care for months and years together with one injection, and you can be off medicine. So the idea is one life to live it full, live it with quality. Why suffer in pain when there are pain treatments available? The whole idea is enjoy life pain free. Thank you. Thank you so much, sir.